When I was first diagnosed with the illness, of course the first inevitable question is after the operation is, how long do you have? Especially being told that it's terminal is quite devastating in itself. Unfortunately, the answer you get is not really a good one. It's only a few months. In my case, it was a few months.
Few people are ever truly prepared to be faced with dying. That's why Hospice of Waterloo Region is so vital to the community. Hospice of Waterloo Region is a charitable organization who helps individuals and their families affected by terminal illness prepare for and cope with death by providing compassionate presence, practical support, and education.
This is a whole new world for me. It's certainly, it is a whole new world, that's all I can say. Your whole life changes.
Our volunteers are the heart of our organization. These specially trained individuals, along with your generous support, make it possible for us to provide our unique programs at no cost to our clients.
I feel clients receive something special from hospice volunteers, mainly a different perspective than the Army, sometimes of nurses, CCA members, dietitians, loved ones coming and asking the similar questions. Hospice volunteer is very comfortable in silence, being there just to recognize either their words or their tone of voice or their body language, and that's all we do.
When I visit a client, I very rarely initiate the activity. The activity comes from the client and the client's interests. That can include very active participation, perhaps driving the client to someone's garden to look at it, or out of town to visit a relative, going to an appointment out of town or in town and waiting with them, just to fit into their day as it is outlined. And the other end of the spectrum, perhaps at a later stage as their illness progresses, might mean just sitting at their bedside or their chair side, just quietly crocheting and reassuring, I am here, everything is fine, I'm here.
Facing death can be fearful for the whole family, and that's why Hospice of Waterloo Region offers programs designed to support all family members. Changing Leaves of Hospice is a program designed specifically for children who are sometimes misunderstood in their grieving because they grieve differently than adults.
My daughter Bethany is 11 years old, and I think that she received two things. Primarily, it was a really safe environment, very comfortable environment that she can meet with others and share and feel free to share. And secondly, I think in that environment she didn't feel odd. She feels comfortable. She feels like one of them. And so they have something in common, something they can share together. And I think that within the context of that type of group, it's really helpful. And she can work through the grieving process much easier in a group like that. And you couple that with the skilled facilitator that's there, who is expert in death and in the mourning process. I think that she's really benefited from all of those.
The benefit came in a number of different areas. It wasn't just the one-on-one volunteer. It wasn't just the getting together on Monday nights for the kids or myself with other parents who'd had a death in their family. It was a combination of forming community, and we all benefited from that kind of enlarged sense of family.
And I didn't want to get into a group where there's a bunch of sobbing and this and that, and a lot of it was sort of an emotional experience. But this was something that was better than what I expected, much better. I came in a little cynically and I left a little more heartened. So.
Hospice of Waterloo Region will provide support to anybody with a life-threatening illness, regardless of what it is, and regardless of their age, their faith, or their economic status.
Hospice of Waterloo Region also plays an important role in the health community, working closely with other agencies to provide complementary care for our clients.
Hospice of Waterloo Region has wonderful staff who sit on many committees at different agencies, partnering with them to provide the best support in hospice palliative care. We listen to their requests, we work together with them to find solutions, and we are becoming a leader in education in the area of hospice palliative care.
I became a hospice volunteer because of the commitment that was shown to me, the sense of community that was extended to me after my husband Peter's death. I had never been involved with hospice before, but this group of people not only embraced me, they embraced the children and helped us with the living part of facing his death. And that commitment to helping us get back on our feet was, I can't explain it in words, it was just amazing. And I knew that if I could extend that same helping hand to someone else, the circle goes on.
Since 1993, Hospice of Waterloo Region has supported individuals and their families in our community. The staff and volunteers of hospice wish to take this opportunity to thank the community for walking by our side and supporting us as we've provided programs for our clients. We look forward to a future of working and growing together as we provide services for the palliative care community.